2.
Hello everybody, my name is Dr. Daniel Markowicz. I'm an orthopedic surgeon at White Plains Hospital, and I'm here talking about orthopedic issues that may come up or things to think about when you are exercising. I think specifically walking is what we're going to talk about today. So a couple of straightforward questions to start off, things that probably will come into your mind before you begin your walk. So how do you best prepare for walking? First off, what shoes are you going to wear? So you don't want to wear slippers, you don't want to wear sandals, you want to wear good gym shoes. And how do you know when to change them? Well, turn them over, look at the treads, and if they're worn down, it's time to get a pair of new shoes. Clothing, well, you want to wear something that is comfortable. There's no specific clothing that is the best, it's just something that you feel comfortable exercising in. And then a very interesting thing to think about with a warm-up. You know, we were taught when we were younger to stretch before an exercise. Actually, stretching before an exercise leads to more injuries. So what you want to do is warm up, just like it says, warm up. So when you're stretching, your heart rate isn't going up, you're actually sitting there stretching and you're increasing your chance for injury. So the way you want to loosen your muscles is to slowly start your exercise, a nice gentle walk, and then slowly and surely increase the rate at which you're walking. Essentially a warm-up, just like it says. So the stretching is going to be after your exercise, part of your cool down, and that's how you warm up and then cool down. So warm up, gently increase your exercises to the pace you'd like to go at, and then at the end, slowly cool down and then stretch. Another question, if I get injured, what should I do? Ice versus heat, stretching versus rest. So a good word to remember for an injury is RICE, R-I-C-E. Rest, ice, compression, and elevation. Now the ice part is an interesting one because there's a back and forth. Is ice better? Is heat better? Ice is helpful for the first 48 hours, and that's to help decrease swelling. After 48 hours, ice really doesn't do much. It may feel good to put ice on, but it's not physiologically doing anything to decrease your swelling. Elevation is always helpful after an injury to help decrease swelling. So rest, ice, elevation for the first about 48 hours, and then after that, just the rest, compression, and elevation will be the most helpful. So moving on in regards to injury, if an injury persists, what should you do? Well, if pain worsens, that's going in the wrong direction, so you're probably going to want to seek some treatment. And if it's a severe injury, then the emergency room is the appropriate place. But if it's a minor injury that is just not getting better, then you can contact your medical doctor, and they will either see you in their office, or they would recommend that you see an orthopedic surgeon if it is a musculoskeletal injury that requires more specialized care. What is the best over-the-counter pain reliever? So two kinds of pain relievers. You've got Tylenol, which is more of a pain reliever. Then you've got anti-inflammatories, Aleve, Motrin, Ibuprofen, as long as there's no contraindication to taking those medications. And you can do both of those medicines at the same time. Some people think you can't do Tylenol and an Advil together. They work through different pathways, so it is safe to take those medications at the same time or close together. So things to consider before surgery, well, it depends on the surgery. One thing that's probably the most important before an operation, if it's an elective surgery, is to try to be as healthy as possible. So if you're a smoker, stop smoking. If you are someone who is a little bit weak with regards to your muscles, build up your muscle strength, because the best predictor of motion and strength after a surgery is what you have before a surgery. So you can do what we call prehabilitate yourself. Get yourself in as good a shape as possible before an operation, and then you'll have a much better outcome. Other things to consider before surgery, losing weight. We're seeing more and more issues with excessive weight, specifically morbid obesity, more complications when you're heavier. So in regards to elective surgery, try to lose weight before surgery if possible. Other things to consider before surgery. See your doctor, your medical doctor. Make sure that you are as healthy as possible before you undergo an operation. And typically with most surgeries, you are required to see your doctor to optimize you for surgery.